Hello, everyone. Today, we'd like to introduce the PainSense, a system that helps visualize one of the most difficult medical experiences to communicate, the pain. Pain is highly subjective. In many clinical situations, patients are asked to describe their pain using a simple scale from 1 to 10, but numbers alone cannot capture where pain occurs, how it evolves, or how it connects to the body condition. So the PainSense aims to transform pain from an invisible feeling into something that both patients and doctors can see, track, and understand together. Before we visualize the pain, the system first needs to detect biological signals from the body. The PainSense uses a wearable sensor called the BioSense patch. So this patch sits on the surface of the skin and continuously captures physiological signals related to pain and inflammation. Through subdermal sensing technology, it monitors signals such as nerve activity, muscle tension, inflammation markers, breathing patterns, and heart rate. These signals are processed locally by the patch and then securely transmitted to the PainSense platform in real time. By combining multiple biosignals, the system can estimate where pain originates and how it evolves in the body. So this allows the PainSense to transform invisible physiological signals into the visual pain maps that we will show next. This is the PainSense dashboard. At the center, we visualize the body using an interactive model. Areas of pain appears as heat map zones, allowing doctors and patients to quickly see where discomfort is located. And on the right side, you can see the possible causes and recovery suggestions under the body insight panel. And around the body model, the system also monitors key physiological signals such as heart rate, breathing, blood pressure, ECG, and activity levels. These signals provide important context that helps explain why the pain may increase or decrease. And on the right, on the top right of the screen, you can see here is the Enter MC mode button, and the doctors can see more detailed descriptions from the patients about their pain. Below the body visualization is the pain timeline. Users can switch between the day, week, and the month views to observe how pain changes over time and how it relates to the physiological patterns. So this transforms pain from a momentary report into a dynamic health signal. Next, we support clinical communication through the doctor notes interface. So here, doctors can add treatment instructions such as medications, physical therapy, exercises, or lifestyle recommendations. Each instruction can be connected to a specific pain area in the body, helping doctors manage the treatment plans more effectively. And this creates a structured way for clinicians to document and communicate care decisions. From the patient's perspective, medical instructions can often be confusing, so the PenSense translates clinical instructions into clear and friendly explanations. Instead of simply showing a prescription, the system explains why the treatment is recommended, how it helps the affected area, and when the patient should follow each step. So patients can also mark activities as completed, helping them stay engaged with their treatment plan. Because the health data is extremely sensitive, PenSense also gives users full control over their information. In the privacy and the settings page, users can decide who can access their data, which types of data that can be shared, and when emergency access is allowed. And users can also view a history of who accessed their data and adjust their preferred language settings. So this ensures transparency, trust, and patient autonomy. So overall, the PenSense imagines a future where internal body signals are no longer invisible. By combining the biosensing technology with intuitive visualization, PenSense helps transform pain into a shared language between patients and clinicians, improving the communication, understanding, and care.